The rash illustrated is typical of herpes zoster, shingles, in the right thoracic dermatomal segment of T8. Herpes zoster occurs by reactivation of the varicella-zoster virus, VZV, responsible for prior chicken pox infection, the virus having been lying dormant in a sensory nerve root ganglion following chicken pox infection earlier in life. Reactivation is often spontaneous, occurring in middle-aged or elderly patients, or may be associated with an immunodeficiency state in patients with underlying malignant disease or HIV infection, or in the postoperative period after major surgery. Severe prodromal pain in the distribution of the affected nerve root usually precedes the development of the typical vesicular dermatomal-based rash by 1 or more days. Commonly, the vesicular eruption gradually fades over successive days or weeks with gradual concomitant easing of pain. The dermatomal extent is unilateral and may be virtually complete, mapping the entire dermatome as in this instance, or patchy. Pain can continue from the outset as in this scenario. Amitriptyline, through its action of inhibiting the nociceptive signals from the periphery, is a helpful adjuvant in treatment of post-herpetic neuralgia. However, this condition can be very difficult to treat and may run a prolonged and debilitating course. D is correct. Any dorsal ganglion can be affected, including cranial nerves, ophthalmic herpes, oropharyngeal herpes and geniculate herpes, Ramsay-Hunt syndrome. More commonly, the vesicles occur on the trunk, as in this patient. Occasionally, spread to the adjacent motor nerve root also occurs with segmental muscle wasting. If the diagnosis is made within the first 24 to 48 hours of appearance of the rash, famciclovir or valacyclovir, either by or IV administration, depending on the severity of the symptoms, should be given and may prevent progression of the disease. In the present case, after 10 days of rash, such antiviral treatment is ineffective and unnecessary. Antihistamines and immunoglobulin therapy are ineffective for this viral infection. If children are in contact with the patient, chickenpox can be contracted from a patient with shingles. But the reverse does not apply.